Hello everyone.
Okay.
Welcome to Apollo Cradle and Children's Hospital session on how to prepare children for vaccination visit. We would like to welcome Dr. Sushanta K. Badatya, who is our in-house consultant, neonatology and pediatrics. He holds degree in MBBS, MD and DNB. We welcome you, Doctor.
Hello, everybody. Today in this session, we will discuss how to prepare yourself and your kid for vaccination. As of vaccination and nutrition are the two pillars of management where we can strengthen the immunity for the baby. Vaccination intends to protect the children for the predefined illnesses. So all the vaccines are not injections, but most of them are shots. So the baby perceives this as a frightening experience. So this vaccination visit becomes a ordeal for the parents as well as the babies. So we will be discussing the few practical aspects about going how to manage the vaccination session for a baby. First of all, there should be some preparation before we schedule an appointment for vaccination. Parental preparation is important. Parents should be aware of the vaccination schedule and the frequency and the timings. Most of the vaccination occurs in first 2 years of life, and subsequently the vaccination frequency becomes lesser. In first 2 years of life, you should maintain a record of vaccination, and the vaccination information sheet you can demand from your physician, or you can get it beforehand, or you can discuss it during the vaccination visit itself. That helps in understanding the nature of the vaccine the baby is going to receive, and anticipated side effects, or anticipated if effects of the vaccination in post vaccination state. They like some adverse effect, like some minor pain or fever, like that, so that you can prepare your personal life or professional life accordingly. Um, Similarly, there should be maintenance of records, so that the physician gets to know about the past vaccination status of the baby, and the any medical condition that may warrant some modification in the vaccine schedule, or some specific advice for the care of the baby after the vaccination shot. So make an appointment prior hand, so that it should not be a surprise for yourself patient, so that the vaccine should be ready. And once the vaccination schedule is fixed, then you should prepare your baby for the vaccination schedule. Uh, the preparation of the baby varies, and it will depend upon the age and the temperament of the baby, and the developmental phase of the baby. Till 2 years of life, they do not need to be primed for any vaccination session. But after the baby is around 2 to 3 years, they need to be primed about vaccination, but not that long before, so that they remain frightened in anticipation of the vaccination shot. So just make the visit to be a health checkup visit, or a well baby visit, so that they will get to know the weight, height, and they should be get well checked up by the physician. So they should perceive it as a health checkup visit rather than a injection visit. So never utter the words like injection, sui, like that. Just you can make them aware that doctor is going to check you for the well-being of your uh, health. And in the last, there will be some poke or some um, shot that will be for good for your health. So, and don't reveal it much before, that just before they are supposed to take the shot, just because their attention span is very small, so they should not spend much time in anticipating or ruminating about the ideas of getting pricked. So once the 2 to 3 years is over, they start reasoning about everything. So 4 years or older, so you should spend some time, like 1 to 2 days prior or 2 to 3 days prior, in explaining that these injections are actually beneficial for your health, and this help in fighting the disease against the disease. It is for your benefit. So they may put up some questions, then you have to clarify accordingly, or you may take a help of your doctor at that chamber itself to clarify the questions. And before you visit, it is very good idea to note down the all queries or questions regarding the effects or benefits of vaccine, or the pros and cons of the vaccination. And don't leave it for the after the vaccination is over, that the baby is not in mood to wait, so your questions may be unanswered. So once you reach the hospital, uh, don't make baby see all the previous babies getting pricked, so that they get frightened. um, so next comes the process of vaccination. During process of vaccination, first is the pain management. So some process are there just to position and the baby while getting pricked, so that make the baby swaddled. If the baby is less than 2 years, you can swaddle baby to minimize the movements. And you can make them hear some songs or some lullabies, like, so that their attention is diverted. So once the baby is a bit elder, then you can hold them chest to chest, or just to restrain by yourself. Don't expose them to the health personnel to restrain, so that they anticipate that something big is going to happen. So next, don't make the process too lengthy. Once you decided that now the vaccination is going to be administered, then that should be quick, and the process should be uh, over within seconds, so that the we know the pain in anticipation is more than the pain of injection in actual. So this process should be quick, and should be ended quickly. And once the process is quick and over, then you can soothe them by either giving some candies or some baby small, and then you can breastfeed the baby, so that the pain is bit lesser. And some studies are there to show that if you practice breastfeeding while getting immunized, so the pain perception is bit lower. And there are some medications available to apply in the injection site, like emla creams, so that numbs the area where the shot is expected to receive. But these are not useful for the deep injections like intramuscular injections. So they are being practiced rarely. But that is a good option if your physician has access to it. Second thing, you before you leave the chamber, just ensure that the vaccination shots are documented in, and the information is registered there. And so that subsequent vaccination schedules are not messy. And once the vaccination is over, you can treat the baby with some travel to the park or some candies or something like that. Don't pamper the baby much, or offer some thing very pricey, so that they anticipate that oh, this may be a very big deal, because I am getting so much attention. So they fear for the subsequent vaccination. So once the vaccination is over, you get the instructions written in the file for the post vaccination management. So watch out for the symptoms the baby is going to experience in next 3-4 days, like bit myalgia, bit inattentiveness or pain or fever. So you can collect the decided medicines beforehand. And if the baby is too unwell, then you can postpone the vaccination. It is said that for mild illnesses like cough, cold, or mild diarrhea, or some ear infection, you should not postpone the vaccination session. For moderate to severe illnesses, and or there is some fever going on and you have not diagnosed the reason, then these are the cases we should postpone the vaccination in consultation with your physician. So once the session is over, that record should be either stored digitally or you can take it home. So I think we can take the questions now. So one of our users have asked any specific diet that we follow before vaccination. Not really. No recommendation for any specific diet, but the, it is practical that you should not take the baby heavily fed, because if baby shows some tantrum or some excessive crying, then baby may spit up. So keep the feeding to be light, and that's all. Like we discussed, if baby is unwell before vaccination, if it's mild illness, then we should proceed with the vaccination. And if he is too well to get admitted, or to receive multiple medications, or the disease process is not yet to be diagnosed or under observation till, then it is better to wait for the illness is over, because the post-vaccination symptoms may interfere in judging the nature of illness. Uh, Now, about the kind of side effects we expect post-vaccination, most of vaccination are sort of mini infections we are giving to the body, but they are not harming the baby. But the baby body is trying to learn the things, so it may show some symptoms in response to the antigen we give via injection or orally. So there may be some locally side effects, local effects, like there may be some redness, swelling, or there might be pain. And systemically, there will be some there may be some fever, there shall be some decrease in feeding, or some inattentiveness for the baby. um, so that is the all mild side effect. And major side effect that may be limited to few vaccines, that is should be discussed with your physician. And some rarely, like 1 lakh people, there will be some severe anaphylactic reactions. So that's why we always advise vaccination in a specific private setup, or government setup, healthcare setup, where the resuscitative measures are available. So we don't advise to get pricked at home itself. Baby develops some anaphylactic reactions, then it will be difficult to manage. So always prefer to get vaccinated in the healthcare setup. Now, question is that now COVID-19 vaccine has come up. Yes, that's now it is approved for emergency use. But once the safety data is enough, so then only it is get approved. So no need to worry for safety. And always we balance benefit more than the risk. So whenever the vaccine is available in the market, definitely there is enough data to suggest the benefit. So the risk data is very minimal. So then that is the phase where we advise the vaccination to the general public. So exactly. Yes. We should. What the method we should use to distract our child from mindful vaccination? During vaccination, don't make them visualize the injection itself. So first, get diverted their face towards other side. Get them engaged in some conversation or some a song like lullabies or some screens. You can show them so that they are engaged to the thing, and you can just visually or by audio method, then you can divert the uh, child's attention. And what vaccination schedule should we follow? Is there any particular schedule that our hospital will provide us? Yes, there are the vaccination schedule is according to the region where you stay. So there are national immunization schedules. Like in our India, we practice the universal immunization program and Indian Academy Pediatrics vaccination schedule. So always there are some specific vaccinations available, and which may be optional for a baby, and according to the health condition, the physician will advise you for the shots. So always discuss and customize according to your child's condition. uh, at a birth, always the hospital provides a vaccination card, and where the schedule is written, and the some information about the vaccination also shared with you. But if the further clarification, the vaccination information sheet are available on CDC website or the Indian Academy Pediatrics website, then you can get it from there. Okay. Should you not feed baby water immediately after vaccination? This is not related to the vaccination, but once the vaccination is over, you can stay observable for next 5 to 10 minutes, so that any major reactions doesn't happen. Otherwise, there is no issue. Okay, I think the questions are over. Should we conclude now? Okay. So, in the session, we learned that the vaccination is important for baby, and the parents and kids should be prepared alike. Um, Vaccination should not be taken as a frightening experience for baby, but as we know, this is for our baby's benefit only. So, parents and babies should be prepared both mentally and physically to get it. So, thank you.